Good afternoon. Thanks for joining us again today. When I gave the COVID update in Parliament yesterday, news was still coming through about the terrible train derailment near Stonehaven. Since then, of course, we've learned the devastating news that 3 people died, a passenger, the train driver and the conductor, and a further 6 people were taken to hospital. An investigation into the accident is now getting underway, and it's important that we allow that to do its work. But in time, we must also ensure that any and all necessary lessons are learned. However, for the moment, my thoughts are with the injured, with all those affected directly by this tragedy, and indeed with everybody who works on our railway. I know they will all be grieving today. But of course, I'm thinking particularly of the bereaved families who face an experience that all of us dread, coming to terms with the sudden and tragic loss of a loved one. No words can ease their pain, nor the awful reality that they are now forced to confront. But the hearts of a nation are with them today. All we can do right now is send them love and support, and in doing so, I'm sure I speak on behalf of everyone across Scotland. I also want to thank our emergency services. The scene they encountered yesterday was horrific in itself, but the location and the circumstances also presented major logistical and practical challenges for a rescue and recovery operation. Our emergency services yet again showed their immense professionalism and dedication to duty, and I am so very grateful to them for that. I'll now turn to the daily update on COVID. An additional 47 positive cases were confirmed yesterday. That represents 1% of the people who were newly tested yesterday and takes the total number of cases now to 19,173. A full health board breakdown will be available as usual later, but my provisional information is that 26 of the 47 new cases are in the Grampian Health Board area, though it's not yet clear how many are connected to the ongoing outbreak in Aberdeen. A further 10 of today's cases are in Greater Glasgow and Clyde, and 3 are in Orkney, and I'll come back to the significance of that later. A total of 258 patients are currently in hospital with confirmed COVID, which is 7 fewer than yesterday, and 3 people are in intensive care, which is the same as yesterday. I'm also very pleased to say that yet again in the past 24 hours no deaths were registered of patients who first tested positive over the previous 28 days, and therefore the number of deaths under that measurement remains 2,491. Of course, that total still reminds us of the overall impact of the virus, and my condolences again go to everyone who has suffered loss. And as always, let me thank everyone who continues to work really hard in different capacities across the country to help us through this pandemic. I have 3 things I want to update on today. The first is to give notice that we will, as usual, publish our weekly report on the R number later today. And to remind people, the R number is the average number of people who will be infected by any one other infectious person. Now, I've said before, and I think this is a point that needs to be stressed today, that the R number does become less reliable as an indicator as the number of cases across the country decreases. And that fact is reflected in the latest figures, which widens the possible range of the R number in Scotland. This week's range includes the possibility that the R number last week was above 1. My information is at this stage provisional. It won't be confirmed until later this afternoon. But the upper estimate last week could have been as high as 1.3. Now, this is in part due, possibly in large part, due to the inclusion of the Aberdeen outbreak in some of the models that we consider. And let me stress again, when the prevalence across the country is low, the R number will be disproportionately affected by outbreaks on the scale of the one in Aberdeen. The report also estimates the prevalence of the virus in Scotland and suggests that on 7th of August there were around 250 people across the country who could have been infectious with COVID. That modelling reflects the low levels of community transmission we are seeing at this time across Scotland as a whole, but it will be an underestimate since it doesn't include all of the cases from the significant outbreak we've seen in Aberdeen. So while it's important to keep all of this, especially the R number, in context and in perspective, it is nevertheless a further reminder of the fragility of our position and of the need for all of us to do all of the things that are required to keep the virus under control. The Aberdeen outbreak and other clusters currently being investigated is the second issue I want to cover today. I mentioned earlier that 26 of the 47 new cases reported today are in the Grampian area. On the latest figures available, a total of 300 cases have been identified in Grampian since the 26th of July. Our information at this stage is that 182 of these are likely to be associated with the cluster linked to Aberdeen pubs, and 961 contacts have now been identified from those 192 cases. In the past 24 hours, Aberdeenshire Council has taken the decision to delay reopening a primary school in Peterhead while a household cluster is being investigated and contact traced. A cluster of 8 positive cases is also under investigation in the Greater Glasgow and Clyde area, and that includes some students who go to Bannerman High School. But it is important to stress, and really important to stress, that none of these students have actually attended the school. They have all been self-isolating at home. There is also currently an Orkney-based cluster which is under investigation, and an incident management team will meet in Orkney later today, and this may include residents of other NHS board areas. All the work that should be done is being done in Orkney to contact trace everyone involved and ensure that they are self-isolating. While Orkney had a number of cases at the beginning of the pandemic, it has had very few since. So I would urge everyone on the islands to guard against complacency. If you have what might be symptoms of coronavirus, please isolate immediately and make immediate arrangements to be tested. We are also investigating if this Orkney-based cluster potentially includes a link to the Aberdeen outbreak. Now, these reports, and I'm reporting today, several different clusters that are under investigation, they should not cause undue alarm. Clusters of this kind, I'm afraid to say, are inevitable. And in all of these instances, our test and protect teams are working as we intended them to do, tracing contacts so that they can be self-isolated and, where necessary, tested, and everything possible done to break the chains of transmission. So we should become more used to hearing about several different clusters, because the virus, as I have kept saying, hasn't gone away. But though we shouldn't be unduly alarmed, it is equally important that we are not in any way complacent. We are, of course, as I've said, looking at details of all of these clusters very carefully, and each and every single one of them should remind us of this central fact: COVID is still present, and it will spread really rapidly if it gets an opportunity. So in and of themselves, we shouldn't be unduly alarmed by these clusters, but if we are complacent either about clusters starting or about controlling them when they do, then it is possible that they lead to more rapid transmission. And that's what all of us have a part to play in guarding against. Now, I've spoken in recent days about the particular risks in pubs and restaurants and the need for hospitality generally to abide very strictly by the rules, and I want to re-emphasise that today. But I also want today to express another concern, and the basis for this concern is coming through our data now, just as concern about hospitality is, and that is a concern about house parties. And I want to stress that these present a considerable risk. So please stick to the rules about indoor household gatherings. No more than 8 people from a maximum of 3 different households should be gathering indoors. And apart from children under 12, people from different households must stay 2 metres apart from each other, and you must wash hands and hard surfaces regularly. I can't make this point strongly enough. These rules should not be seen as optional. They are absolutely vital. In many respects, they are the most important part of that first line of defence, all of us, that I keep talking about. You know, clearly what people do within their own houses is harder for any enforcement action to work against. So more than ever, it relies on the good sense and judgment of all of us. Because the bottom line here is if these rules are not complied with strictly, this virus is going to spread, and we have evidence of that already. And I don't want us to be in a position of having to put more restrictions again, as we have done already in Aberdeen, on the ability of people to meet others indoors. So I make a really strong appeal today, and particularly to young people. And let me stress again, I'm not trying to single out young people or to blame young people. I just understand the things that young people with a bit more freedom now as we started to come out of lockdown want to do. But please take great care. House parties really are not sensible things to be doing right now. Keep within the rules about indoor gatherings. Finally, the issue I want to cover today relates to PPE. I've spoken before about some of the steps we're taking to ensure secure and sustainable supplies of personal protective equipment. The need for large volumes of this equipment within the NHS will continue for the foreseeable future. So one of our priorities has been to develop a supply chain within Scotland where possible, which can help us meet this demand, but also which can help us boost the economy as well. And I'm delighted to confirm today that Alpha Solway, a company based in Dumfriesshire, will supply a £53 million contract for NHS Scotland to supply 232 million surgical masks, 6 million respirator masks and 2 million visors. This order, which will support 200 new jobs in Dumfries, is expected to meet the needs of our health and social care sector in relation to surgical masks and visors between now and next summer. It will also meet most of the sector's requirements for respirator masks. This contract is a really important step in ensuring that Scotland has secure supplies of PPE for the foreseeable future. It will also deliver significant savings to NHS Scotland, and it shows that Scottish businesses are competitive against international suppliers. So this is a really good example of the way in which many manufacturing businesses in Scotland have adapted to help the fight against COVID while also supporting employment. So it's a welcome piece of positive news in what I know is still an incredibly challenging time for businesses across Scotland, and therefore one that I wanted to make particular mention of today. So these are the three main points I wanted to cover today, but before I finish, as you can probably predict, I want to emphasise again the importance of facts. The clusters I mentioned earlier are a really stark reminder that this virus still poses a risk to us. It is still present, it's still highly infectious, and it is still capable of causing serious harm to health. We can only continue to make further progress out of lockdown rather than going backwards if all of us think very carefully every single day about the individual choices we are making. I've said before and I want to say again, wherever you are right now, in your own home, in somebody else's home, in a pub, a restaurant, outdoors, just assume the virus is there around you, because it may very well be. And therefore think about how you avoid giving it a bridge to travel from you to somebody else or from somebody else to you. And the key ways of doing that are encapsulated in the facts advice. So let me just briefly repeat what they are. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces regularly, 2 metres distancing remains the overall rule, and self-isolate and book a test if you have symptoms. These are golden rules, and every single one of us, if we abide by these golden rules, help to make sure that we give ourselves the best chance of keeping COVID under control. Thank you very much, as always, for listening. The Health Secretary's got a few words to say now before we then move on to questions, which of course the Chief Medical Officer is joining us today to help answer as well. Jeane.
Thank you, First Minister. We've spoken before about the impact COVID-19 has had on all our lives. Some have faced the personal experience of ill health. Very sadly, many are coming to terms with the loss of a loved one. And everyone has had to deal with the impact of lockdown restrictions and a very changed way of living. And whilst our knowledge isn't complete, we do know that the virus can leave long-term physical and psychological consequences for many who contract it. So today we're publishing our framework to support people through recovery and rehabilitation. The framework covers 3 distinct groups: people who have had coronavirus and as a result are experiencing pain, fatigue, cardiovascular or pulmonary issues, or neurological and cognitive symptoms like anxiety or PTSD. There are also those who may be experiencing, for example, musculoskeletal problems as a result of shielding, or the exacerbation of other health issues such as COPD or type 2 diabetes, and others still who have multiple health conditions and need ongoing rehabilitation and support. The framework that we're publishing will help our NHS boards and health and social care partnerships as they plan the restart and prioritisation of their services and help us to ensure consistency across the country. The work is led by Caroline MacDonald, our Chief Officer of the Allied Health Professions, and has been brought together with the help of clinical experts, but informed also by condition-specific organisations like the British Lung Foundation, the Stroke Association versus Arthritis, the Royal Colleges and our Scottish Trauma Network. This is important work that aims to help people now with the impact of the virus and, importantly, through rehabilitation, also improve existing conditions and overall health. If you're interested in looking at that framework, you'll find it on the Scottish Government's website.
Thanks, Jeane. We'll go straight to questions now. Katrina Renton from BBC Scotland is first.
Good afternoon, First Minister. We wanted to ask you if you're worried about a pattern emerging. There's obviously the cluster in Orkney, the cases of pupils from Bannerman High in Glasgow who obviously weren't at school, and now NHS Grampian saying it's investigating the case of COVID connected to Peterhead Central School, and it's been closed as a public health precaution. Clearly, this will be of concern in this week that the schools have gone back. Is this sustainable, or are there patterns going to emerge that are going to lead to more school closures?
I think it's really important, firstly, to say, is it a concern? Every case of COVID and every cluster of COVID is a concern, and I think people can see that reflected in the seriousness with which we are continuing to react to all of this situation. But I think it's important to investigate every cluster very carefully, learn any lessons, identify any patterns, and make sure we're breaking the transmission. And it's really important that we are very careful about what conclusions to draw and what conclusions perhaps not to draw. It's in schools, and schools are in the process of returning this week. There is guidance in place for schools that was put together with a lot of thought and care and scientific advice, and we will keep that under review, as I've said before, and if we feel we need to change that in any way, that's important. John Swinney also announced yesterday that any member of staff in a school, even if they don't have symptoms of COVID, who feels they may have been exposed to infection, can be tested. So that is an important further protection and precaution, and I hope assurance. We will, unfortunately, in all likelihood, see outbreaks in schools, and it's important that test and protect works there as it works elsewhere. But we will also see, as appears to be the case in Bannerman High, that we will have cases and outbreaks that may have links to schools in the sense that it may be pupils or staff who attend those schools, but it is not accurate to say that the outbreak is actually in those schools or about those schools. And what I'm about to say is not a criticism of the media. I think by and large the media have been excellent in reporting the COVID outbreak so far. But I saw some headlines yesterday about Bannerman High School that gave the impression at first glance that there was an outbreak in Bannerman High School. And my appeal to everybody would be, let's just be very careful around all of this. It's important that we understand these outbreaks and then take appropriate action. And as you've heard me say many, many times, standing here, we are looking all the time for patterns, for connections, for anything that tells us how we prevent, hopefully first and foremost, but then break chains of transmission. The one thing, just final point, Gregor might want to add, I would say, is that the two things I have mentioned so far as areas of particular concern, and this again is not meant to be a criticism of anybody, these are not things I'm saying randomly. It's because the analysis of the data we have so far would show that hospitality and, as I've mentioned today, house parties are particular risks if people are not strictly and rigidly abiding by the rules. And so I want to emphasise again today, if you're in a pub or if you're in somebody else's house, the rules around maximum numbers that you should be with and physical distancing, these apply, and it's really important that everybody abides by them.
So I think what we're seeing just now is just the inevitable consequence of opening up society again and bringing people closer together. And the closer people come together, the more likely those chains of transmission are likely to establish themselves. And we see the infection beginning to grow into these clusters. Of the analysis that we're doing just now, and we're really trying to make sure that we are learning from each one of these outbreaks as they happen, looking for common learning from each one of the particular circumstances of those. And really involving not just the learning within Scotland, but also in constant links with other UK CMOs to see how they're learning from their outbreaks as well. But as the First Minister's already outlined, there's two common features that are really especially coming through just now, and that tends to be that, unsurprisingly, transmission happens in more crowded situations, but particularly in relation to pub environments and house parties as well. So we need to make sure that we are communicating to people really, really effectively that these, if we're not careful, if we let our guard down, are going to be the weakness in our system just now, where if you're visiting those places, if they're crowded, if you're not adhering to all the guidance that we've asked you to adhere to, then the risks of transmission become much, much greater.
Susan Rippell from STV.
Thank you, First Minister. Given the size of the population in Orkney and how quickly this virus can spread, are you looking at a local lockdown there at the moment? If not at this stage, then at what point would this cluster need to get at that you would take this action?
I don't want to, it's a perfectly legitimate question, Susan. I don't want to get too ahead of where we are right now. The IMT in Orkney will be meeting later today. We will then get a report from that and we will look carefully at whether there are decisions that require to be taken, but we don't yet have the detail of information that would allow us to do that right now. So I don't want people to read into what I'm about to say as any particular direction of travel in Orkney, but I think as you have seen in Aberdeen, where there is evidence of us requiring to take particular steps and impose restrictions, we will not hesitate to do it because keeping transmission under control is so important. So we'll be looking very carefully at the deliberations and the conclusions of the IMT once it's had the opportunity to meet in Orkney today. But you're right to point to some of the particular circumstances faced on our island communities and in our more rural communities, where obviously one of the issues is health infrastructure and the other parts of infrastructure. So we pay attention to outbreaks everywhere, but of course the peculiar circumstances of our island communities are obviously particularly in our minds. One thing I would say is that, and this is true of Orkney and some of our other island communities, they often go and have gone a long period of time without cases, and human nature being what human nature is, that may understandably lead to a sense of feeling on the islands that the threat has gone, the risk has gone, and therefore maybe people are not being as assiduous in complying with all the rules. So, again, I would take the Orkney situation right now and say to people in all of our island communities, just remember, even for you, this risk is still there. So it's just as important that you're complying with all of these rules as it is that people on the mainland are doing so. Tim Backenshaw from ITV Border.
Thank you, First Minister. I want to ask a bit more about the Alpha Solway announcement. Obviously, great news for jobs in the southwest of Scotland. Is it your plan to make Scotland self-sufficient in PPE to prevent any future shortages?
We want to be as self-sufficient as possible, but I think given the nature of the marketplace for PPE, I would not for a moment stand here and say that we will not place orders elsewhere across the UK, across Europe, across the world. We will source PPE from where we can get it when we need to get it. But obviously, the more we can build the capacity of the supply chain here in Scotland, the more resilient those supplies are likely to be. But also the more we benefit our local economies, and that's obviously something we want to do. And the Alpha Solway contract is massive good news for that company, for Dumfriesshire, but also for Scotland and for the NHS here, because the security of supply that gives is really important. Jeane, do you want to add in terms of the wider health issue?
What I would add is excellent news from a NHS Scotland's perspective, because, as the First Minister said, it does add to the security of supply. Our national procurement exercise is well underway to ensure that we are building back up the stockpile and that we have projections ahead for what we might need by way of PPE, continuing to be the suppliers across both health and social care, as we have been, that will take us through the winter months and through well into next year. So knowing that we have that supply available to us only a few miles away from where we might need it is a very helpful assurance as we look to see what more can be done with our colleagues elsewhere in government in terms of other manufacturing options, but also to maintain our strong links with the other suppliers that we have, both in the UK, in Europe and elsewhere in the world.
Thanks. Fraser Knight from Global.
Thank you, First Minister. We've touched on the number of cases among pupils at Bannerman High. This week we've also seen a potential cluster of cases among pupils at Portlethen Academy in Aberdeenshire as well. Now, your school guidance says that pupils should social distance where possible while in class, but we know that that's not always going to be an option. And we also know that some 16 and 17-year-olds are as much adults as some 20 and 30-year-olds are. Is it not the case that if they've managed to pick up the virus before they've even stepped foot in school, that as soon as they go into a class where there's no social distancing, that this could spread like wildfire? And will you relook at the guidance on whether perhaps senior pupils should have social distancing as mandatory for them in school, or perhaps even wearing face coverings?
First thing, and you did make this point yourself, Fraser, but I just want to emphasise it for the benefit of people watching. The pupils we're talking about here did not get COVID in these schools. They are pupils who go to these schools. So I think, again, it's just really important to be clear about that. We keep the review, the guidance, and I've said this already today, we will keep the guidance under review. I want to, though, also be very clear that the guidance that is in place right now, which for older, more senior pupils recommends physical distancing where that is appropriate, but prioritises getting young people back to school. That is informed by scientific advice. Our scientific advisors have looked at the evidence from other parts of the world to come to the recommendations that they have made. But we will continue to look at emerging evidence, both here in Scotland, elsewhere in the UK and internationally. And if we think we need to change that guidance, as we have done in other aspects over the course of this pandemic, as our knowledge expands, we will do that. And at every stage, we will take a precautionary and a very careful approach to what we are asking people to do. And that will apply in schools, just as it does in other aspects of society.
I've got a very open mind to receiving new evidence all the time in relation to schools, and I'm always happy to review the evidence base that relates to that. But what it tells us just now is that children and younger people, particularly that older age group of school children, are much more likely, if they're going to catch the virus, or if they're going to become infected, that's much more likely to happen in social circumstances in any of the studies rather than in the school environment. And I think it's right that we maintain an open mind in terms of constantly reviewing the evidence and the experience that we have in this country. We will continue to do that. But the balance of the evidence at this point in time certainly has led to the production of the guidance that was issued this week in relation to how schools will return. It's really, really important that as these school pupils go back, they understand that they must still continue to distance where that's possible, because what we want to do is to try to limit any opportunities. But the really important factor in all of this is what is the prevailing prevalence of the virus in the surrounding communities, because whether it's an office, whether it's a school, it will be a reflection of what's going on in that external environment. And at the moment, with very, very low levels of this virus across Scotland just now, it's certainly safe for the guidance to be framed in the way that it is.
I think that's just, I'll round this off because it's an important issue with 2 points. One, to emphasise that last point Gregor has made there. all of us have a role to play in protecting schools, because if we keep the virus under control in the community, then we help to make sure it doesn't get into schools. It is the community prevalence that is the most important issue here. So it's another reason why we all have to be really careful and be hyper vigilant in our own lives, so that we are minimising the risks of community transmission and therefore minimising any risks of the virus getting into schools. But the second point I'd make, and you've heard me over the last week or so talk about the changing age profile of cases, so I should start this by saying this is something that is under close review. But as of now, it's only around, in fact, I think it's less than 1% of all of the 19,000 or so cases, confirmed cases we've had in Scotland are in the under 15 age group, and I think around 2% that are in the under 20 age group. So that gives some degree of context there. But of course, all of this will continue to be kept under the closest of review of all of the things hopefully you have garnered watching us here over the last few months, whether you've agreed with the decisions we've taken or not. I hope you've got the very clear impression that we are not complacent about any of this and will not shy away from changing direction if we think the evidence is there to do that. Alan Smith from Bauer.
Thank you, First Minister. Just in regards to the Aberdeen lockdown, can you update us in terms of any discussions the Scottish Government's now had with the UK Government when it comes to financial support for those businesses? The Federation of Small Businesses has suggested the rollout of local grants if the lockdown continues much longer. Is this something that's being considered? And a question for the Chief Medical Officer. At the end of March, the then Chief Medical Officer said 65,000 people in Scotland may have contracted coronavirus. Given that not everybody will be tested and have it confirmed, do you have any updated estimates on how many people in Scotland you believe may have contracted the virus so far?
I'll hand over to Gregor on that point in a second. I've made the case, the Scottish Government has consistently made the case to the UK Government about the extension in some form or other of the furlough scheme so that it doesn't come to a premature end in October. We're also looking ourselves at the further steps we can take to support businesses in local lockdown scenarios, and when we've concluded those discussions and deliberations, we'll set out those conclusions. But, and again, let me make clear, I'm not making a political or constitutional point here. I'm just stating the facts and the reality. We have, because we have very limited borrowing powers of our own in Scotland, there is a financial limit to what we can do without either further borrowing powers, which we would then have more flexibility ourselves, or further consequential funding from the UK Government. So the importance of persuading the UK Government to continue and to look to extend where appropriate support is extremely important.
So one of the ways that we can tell how many people have been exposed to this virus is by looking at how they develop antibodies by doing what we call serosurveillance. So this is about how we take blood from people and analyse that to see whether there's evidence that the body has mounted an immune response. Of course, we don't yet know at this stage whether that immune response means that they've got lasting immunity to the virus or not. But what it shows is that there's at least been an exposure there at this point in time. Of the data that we've looked at with this, clearly that our numbers have not been moving significantly up the way in terms of our overall infection in Scotland over recent weeks, which is a good thing. But the last report that I had for this showed that it's very small numbers of the Scottish population that had still been exposed to this virus, and certainly in the single figures of percent, probably around about 4 to 5%. And that's probably consistent with the picture that we're seeing across Europe as well, where very low levels of populations have yet to be actually exposed and develop antibodies to this virus.
Thanks. Neil Pooran from PA.
Thanks, First Minister. If I can ask about exams and the role of the SQA. The Chief Executive, Fiona Robertson, has expressed her regret over what happened, but she hasn't really apologised. And critics of the SQA, including some MSPs in your own party, have said they ignored warnings about the moderation system that they were going to use. Do you think it's time for the SQA to say sorry over what happened?
I've said sorry, and John Swinney has said sorry, and we are, sorry if this sounds a bit old-fashioned in today's political culture, but I think it's important for ministers to take responsibility and apologise where an apology is to be given. We've obviously indicated there will be an inquiry and a review of the circumstances this year, and I think it's important to allow that to do its work. But the SQA, as I've said previously standing here, they did what government asked them to do, to come up with a model that would maintain comparable standards this year to previous years, and that's what the SQA did. Ministers have reached a judgment that, however legitimate and objective it was to try to maintain comparable standards, we think actually looking at it again, it possibly wasn't the most important thing, because it left young people this year who didn't get to sit exams, who have had the hopefully unique disruption of COVID this year, with a feeling that their futures were beyond their own control, and no matter how hard they had worked, an algorithm decided their results for them. And we have decided to put that right by awarding qualifications on the basis of teacher estimates. So that's the decision the Scottish Government has reached, and I think it's important for Scottish Government to take the responsibility for that, to say sorry where that is appropriate, and it is appropriate in the circumstances, and to set out what we have done to put it right. We're seeing, obviously today, a similar situation. 25% of grades were downgraded in Scotland, which of course we've now put right. It's nearer 40% in England, so this is not something that was unique to Scotland. But in Scotland, we have taken a decision to go down a different path, and we think that is right for the young people concerned. Christine Lavelle from The Sun.
Thank you, First Minister. Positive test numbers are up from the typical daily levels of fewer than 20 a month or so ago to an average of 49 in the week to yesterday. Can you clarify, is this at least is at least part of this due to more tests taking place, so we're picking up more cases, or does all the data that you have suggest that the virus could be growing in the community again?
Well, I think, as I've said before, there's a bit of both. So what I'd encourage you to do, and I've made this point previously, and I include this figure now in my daily update, is not just give the number of new cases, which, yes, you're right, Christine, can go up or down depending on how many tests you're doing every day. But every day now, I also report on the percentage that represents of the people newly tested. So 47 cases today is 1% of all the people we newly tested yesterday. And that gives you a figure that you can compare consistently day to day, regardless of how many tests are being done. And what we've seen over the last couple of weeks is that on most days, I still think this will be accurate now, on most days that number has been slightly below 1, but on some days now it has been 1 or slightly above 1. And what that would suggest is that we have a bit of an uptick in cases. That will be skewed, actually in reality quite significantly by the Aberdeen cluster, given the scale of the Aberdeen cluster. But I don't think we can discount the possibility that we're seeing a bit of an uptick generally in cases, which is why we're encouraging people to be as vigilant as we are. Let me just end with, I suppose, putting all of that in a global context and remind people that the WHO definition of an outbreak, an epidemic rather, being under control is that a country has had the test positive percentage under 5% for a 2-week basis. And clearly we are at this stage well under that, but a bit higher on most days at the moment than we were seeing perhaps 2 or 3 weeks ago. So what does that all conclude, or lead me to conclude, is that prevalence is still pretty low across Scotland as a whole. We have a significant outbreak in Aberdeen, which will be impacting on those overall figures, but we shouldn't be complacent about, as we come out of lockdown, a more general uptick, which is why it is so important that all of us stick so rigidly to the rules.
Yes, so that percentage positive has crept up marginally over the last couple of weeks in particular, and there's a huge influence of the outbreaks that we've seen in terms of the way that figure has started to do. I prefer the 7-day average of that figure compared to the kind of daily figure of it, because it gives you just a little bit of smoothing in terms of the variation that you can get from day to day as well. There's no doubt about it that outbreaks will continue to influence that figure as we go forward, but if you take the outbreaks out of that picture, then what you start to see is that there are still very low levels of this virus across the communities elsewhere in Scotland. Now, as the First Minister's outlined, that doesn't mean to say that we can be complacent, because if you keep a close eye on the figures over the last couple of weeks in particular, you'll see that where one board one day can see a little uptick, another board another day might see the same thing as well. So there is no room for complacency here at all. We need to make sure that we all continue to kind of adhere to the measures as often as we can, just to safeguard both ourselves but also those round about us too.
Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Just back on the issue of house parties, can you just clarify what power the police have to break up house parties? I'm sure you'll correct me if I'm wrong, but my understanding is they can't actually enter someone's home. So would you look at changing the law or strengthening the police powers to tackle this? And also, just quickly, you mentioned there was a potential link between the Aberdeen outbreak and the new cases you picked up in Orkney. I wonder if you could just say a little more about that link. You know, what specifically is that? Thanks.
No, I'm sorry, Dan, I can't say more about that right now because it is still being investigated by the incident management team. But if there is a conclusion that there is a link, we will be able to say later what that is and how it's being managed. But it wouldn't be helpful, I think, for me to speculate beyond what I've said today. I was just making the point that often, particularly if you think about some of the travel patterns to and from Orkney, then that kind of thing wouldn't necessarily be surprising, but we'll wait to get more details later on. Your point about enforcement is right. You know, there is, from day one here, there has been a balance between encouraging people to do the right thing, which by and large people have been doing and continue to do, and police enforcement powers. And where we think it is necessary, we will not hesitate to increase the ability of the police to enforce. We've made, over the course of recent weeks, we've made face coverings mandatory in shops and public transport, where previously it was guidance. We are about to make the collection of customer details in pubs and restaurants mandatory, where previously it was guidance. So we will always look, if we think there is a problem with compliance, of toughening up the enforcement powers. But when we have to do that, I think it's always second best from the situation where people are complying because it's the right thing to do, because we're all trying to protect each other from this virus, and particularly in people's own homes. You know, there's always going to be a common sense limit on the ability. The police can't be in everybody's home checking that you're not breaking the rules. So I come back to the point I make so often right now. This is on all of us. It's our responsibility as individual citizens to decide whether we think it's really important to stop this virus having the chances to spread. So I would just appeal to people, even where something is guidance and not mandatory, it's not guidance for no reason. It's guidance because we think it's really important that you do it. And, you know, we're seeing the consequences in some of these clusters of people not abiding by all these rules. So please, all of us should just be thinking about doing the right things for the right reasons. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Just to go back to house parties again, you mentioned this is coming through in the data. Can I ask exactly how it's being reflected in the data? Is there any stats you could share today which illustrate how much of a problem house parties are? And is this something that has been highlighted by the police themselves?
No, this is. I can't give you figures today. We'll look at see whether we can give more that would quantify that. Obviously, you know, respecting confidentiality of individual people. But this is data that's coming through Test and Protect, because the key function of Test and Protect, if the virus gets past our defences, is to jump in and try to stop it in its tracks and break lines of transmission. But the other thing we get from Test and Protect, who speak to positive cases, work out who they've been in contact with, trace those contacts, is we get a very detailed picture of where a person might have got the virus, and therefore it's information coming through that tells us house parties are a bit of a risk and a bit of a problem right now. That said, I mean, you'll recall previous sessions here, going back several weeks now, when the Chief Constable has stood here and said, even when we were still in strict lockdown, there were, you know, some concerns at the margins about people having house parties. So the police certainly have flagged that up at earlier stages. But the data I'm talking about is the data and the intelligence we're getting through the work that Test and Protect teams are doing. Gina Davison from the Scotsman.
Hi, thanks, First Minister. Can I just ask about the R number again? Back in May, when you said it was too early to lift lockdown across Scotland, the R number was between 0.7 and 1 at that time, and today you're estimating it, originally it's an estimate around 1.3 possibly, and you're saying this is skewed by Aberdeen. There might be links between Aberdeen and Orkney. There's outbreaks in Glasgow and Inverclyde, and I just wonder, I think, people might be a bit concerned that, we could be looking at a national lockdown again sooner rather than later if it continues this way. And is that something that you're contemplating at all?
I'm not contemplating right now another national lockdown. I can't stand here, and I've tried to be really frank with people and really straight with people all throughout this. Equally, I can't stand here in the midst of a global pandemic and rule anything out, but I want us to do everything we possibly can to avoid local lockdowns and a national lockdown, and that's why I stand here every day and stress the individual behaviour that is so important. You're absolutely right to point out what we said about the R number in May, and if you take that compared to today and don't consider what we said in between, you can see the sort of the point that you're making. But of course, what I've said on many occasions, because and you will find governments everywhere saying the same thing. As in May, prevalence was higher. So as prevalence of the virus becomes very low, as it has been overall in Scotland for the last few weeks, small changes, and particularly localised changes, will have a disproportionate impact on the R number. So, a 1.3 R number with prevalence as it is overall today, I'm not saying it's something we shouldn't have any concern about, but it's not the same level of concern as you would have had about a 1.3 R number back in May with prevalence much higher. If there are fewer people that are likely to be infectious, then even if each of them will be infecting 1.3 more people, that is fewer people than if you've got a much higher number of people that are infectious. So your starting point is different. I hope that is making some sense to people. So we're not complacent about any of these things, but as prevalence shifts, some of the indicators that you look at and pay most attention to are different compared to when prevalence is low compared to what you look at when it is high. But all of these things continue to be very, very, very closely monitored and interrogated by us.
There's lots of caveats that we must begin with when we're talking about the R number today, and the first of those is that the figures that we've spoken about today are as yet unverified. They need to go through a formal process and agreed, which will happen later on today. But the indications that we're seeing is that confidence interval around about where we construct the R number, the very complex mathematical models that take a couple of days to run in Scotland's fastest supercomputer, have showed that confidence interval is widened, that it's now somewhere between 0.6 and 1.3. And what that is skewed by is these very concentrated outbreaks of activity that we're seeing in some parts of Scotland just now. There's a range of data which is used to try to develop that R number. And as I say, all it can take is for some of that data to be slightly not representative of Scotland as a whole, to make huge changes and impacts on the way that R number is then presented. Now, what does that mean for us? It means that the R number is not as good a representation of what the Scottish national picture truly is when we have very low levels of prevalence. However, we really need to take notice of it as well, because there is still an influence on that R number from these outbreaks, and what it perhaps serves for all of us is a warning again that this virus hasn't gone away, and that actually it really doesn't take much for us to trip into that exponential growth again in some areas, and we should all be very, very cautious that we don't allow that to happen across the country as a whole.
And the last question today is Michael Blackley from the Daily Mail.
Thank you. Good afternoon. We had official figures yesterday that showed the UK GDP falling by 20.4% in April to June. Obviously, there's a bit of a lag before we get the Scottish figures on that, but do you expect to see something similar in Scotland? Do we need to accept that there's going to be bad economic times ahead for some time to come? And do you think large-scale job losses are now pretty inevitable?
I think the first thing I'm going to try to do, with the greatest respect, Michael, is avoid writing a Daily Mail headline in the way I couch my answer to this. I'm not going to speculate on what official statistics might show in Scotland before those official statistics are published. So, you know, but yes, obviously, we are dealing with an economic crisis that has been caused by the health crisis of COVID, and that will be seen, as it is being seen across the UK, unfortunately, in lost GDP, but also in an impact on employment. And we saw just in recent days the latest employment and unemployment figures for Scotland, which show some of that impact. Clearly, with employment and unemployment, the picture is being influenced right now by the continuation of the furlough scheme, and there is a big concern that as support is withdrawn, we will see an acceleration of increased unemployment. So what that takes me to is that all of us in government working together, we have to accept that there is an economic impact of what we have done. That you know, common sense unfortunately tells you that. Our focus now should be on, firstly, making sure we are providing the most sustainable foundation for an economic recovery. And that means keeping the virus under control, because we see in Aberdeen right now what happens when we don't keep the virus under control. Restrictions have to be imposed again, and that is the worst possible thing for businesses. So keeping the virus under control is the key thing we have to do. And then we have to make sure the right support is in place for businesses in the short term, to make sure that we are supporting jobs through the short to medium term, but also in a way that allows us to invest for the future, to come out of this crisis with a clear focus on the kind of economy and the kind of economic recovery we want to build. And of course, we published earlier this month our response to the report of the Economic Recovery Group, setting out how the Scottish Government intends to take on that task. So these are big challenges. You know, and they are challenges of health and challenges around the economy and jobs. And as I've said before, and it is probably a reasonable place to start for the foreseeable future, the two priorities of this government, and I'm sure it will be the same for governments elsewhere, is health and jobs, because these things are very linked, and everything we do must be about protecting health and keeping the virus under control and making sure we're protecting the economy and people's jobs, short, medium and long term. That concludes the questions for today. So can I thank the journalists for joining as always. Thanks to Gregor and Jeane and Robert, our BSL interpreter today. Thank you to you for joining us. I'm very aware every single day right now that times continue to be tough. We're all continuing to live under these restrictions. The economic impact of all of this, I think, becomes realer for many more people with every day that passes. And of course, we have had in the past 24 hours the heartbreaking incident near Stonehaven as well. So this is a tough time for everybody, but it is also a time for us to remember our responsibilities to each other and remember that how we behave right now determine the speed and the progress that we make out of this COVID crisis. So I will end with that usual appeal to everybody, to those watching, but can I ask everybody watching, because I know young people are going back to school, some people are going back to work. There's probably not as many people watching now as was the case a couple of months ago. So if everybody watching can repeat this message to people who are not watching, people in your families or your friends, network, people you work with, abide by the facts, rules. It's so important. Face coverings in enclosed spaces, avoid crowded places, including house parties, clean your hands and hard surfaces regularly, be obsessive about it, 2 metres distancing from other households, even in your own house, and self-isolate and book a test if you have symptoms. It really matters that all of us do all of these things all of the time. So please, I'm asking for your help in taking that message to as many people as possible. Thank you for joining us today. I'll be back tomorrow at 12:15 for the final briefing of the week. Thanks very much.